All right, well, we'll go ahead and get started. We have a really packed agenda for everyone this morning. So good morning, everyone, and welcome. My name is Keisha Ledlow, and I'm the project director for the Texas System of Care with the Health and Human Services Commission. And we're so delighted to have you join us today and hope to begin a meaningful discussion with you around youth crisis respite and the important role it plays in our ability to fully serve youth and their families as they move towards positive outcomes. Whether you're just learning what crisis respite centers are and how they may benefit your community, or you're already considering how you might design a crisis respite center for your area, we hope that you find the information presented today helpful and grounded as you move forward in your planning process. We know that developing a youth crisis respite center involves a great deal of commitment, community collaboration, and time. There are many ways to provide youth crisis respite services, and it's a process that involves multiple decision points throughout the development that will differ depending on the crisis respite model and approach you adopt and the unique aspects of your communities. Our goal here today is to offer a common foundational understanding of what youth crisis respite is, the difference it can make for our youth and families, and finally, through the experience and knowledge of several experts who have been successful in establishing youth crisis respite centers in their communities, identify and discuss those key considerations for you and your communities to decide on as you move towards planning youth crisis respite, and share some important lessons learned by our experts as they went through this process. We're so excited today to be joined by Kelly Guerrero, Program Director of Chase House Clare Center for Families, Jessica Jimenez, Youth Crisis Respite Case Manager, Clare Center for Families, Melissa Ramirez, Youth Crisis Respite Director, Hill Country MHDD, and Teresa Thompson, Licensed Clinical Social Worker and owner of Texas Counseling PLLC, and who also served as the former Clinical Director for Hill Country MHDD and led the effort to establish the Hill Country Youth Crisis Respite Center. Before we begin, we have just a couple of housekeeping items. First of all, we ask that you please place yourself on mute throughout the webinar in order to decrease background noises. We also ask, as Tracy mentioned earlier, that you put your name, email address, and organization in the chat, just so we can get a sense of who's in the room with us today. There will be an evaluation at the end of today's webinar. We use that information in planning future events to make sure that we're really meeting the needs of participants. We will also be sending out the PowerPoint that will be used in today's webinar. So without further ado, I would like to turn the webinar over to Melissa and Kelly, who will introduce us to what youth crisis respite is, what it does, and help us build a common understanding around the important role youth crisis respite services play in the continuum of care for young people and their families. So Melissa and Kelly.
Hi, good morning. I'm Kelly Guerrero. I'm the Program Director for Chase House, formerly Child and Adolescent Respite of Clare Center for Families, but we had a great donation, and so we recently changed our name to Chase House. So I'm happy to be here this morning.
Hi, good morning, everybody. My name is Melissa, and I am the director for the Youth Crisis Respite Program with Hill Country MHDD. And I'm so excited to be here to share all the wonderful things that respite does for our communities. I am sharing my screen. Can you all see this?
Yes.
Beautiful. Wait, is it there, everyone? It's blinking for me.
Yeah, it's blinking for us.
Ah, that's unusual. All right. Maybe it's just the first one. Okay. Is that there for everybody now?
Yes.
Perfect. Okay, so I'll kick it off. Our first intro slide was just, the youth crisis respite and a brief intro, which Kelly and I have already done. But if you're wondering what the Youth Crisis Respite Center is and how our programming works, we are a short-term residential care for youth and adolescents who are identified as in crisis or in need of crisis prevention. Both our programs, I believe, promote a living room model in community crisis respite programming. So it's a very, very safe, calm environment. It's modeled after a home environment. It's non-restrictive. You walk into either of our placements and it looks like a regular home. And so it's meant to be safe, nurturing, calming, and supportive for that individual that's in crisis, and hope to create that peaceful ambiance and culture without a more intensive or intrusive intervention.
So what's the purpose and vision of a youth crisis respite? It is to prevent out-of-home placements or a need for a higher level of care, to provide youth with skills to help them better function at home in the community. So without respite, we know that a child may run away from home, end up in juvenile detention, or even in a psychiatric inpatient hospitalization. So we like to provide crisis integration while fostering community integration. Give a short-term break to caregivers. Respite can be anywhere from 1 hour to 7 days. Provide services that promote autonomy, respect, hope, empowerment, life skills, and social inclusion. So we're a trauma-informed environment, and allows for the least restrictive, accessible, and culturally sensitive, caring, and supportive environment for our youth, our staff, and our families while they're utilizing respite services.
So youth crisis respite is defined differently across the state. So we'll talk a little bit more about our definitions throughout the webinar today and throughout our panel. But our definition of youth crisis respite are services that are designed to be preventative by reducing the need for more intensive services, such as psychiatric hospitalization, use of emergency room for non-medical emergency care, and the use of juvenile detention when inappropriate. Our goal is to keep kiddos as much as we can out of those more restrictive placements, because they can be trauma inducing. And so we were recognizing a need in the state that there is a gap in this crisis intervention service where there isn't that middle ground for kiddos. It's either, inpatient hospitalization, sitting in an ER, or going home with a safety plan. But sometimes kiddos needed just a little bit more, but not something that's that intensive. And so crisis respite is also defined in line item B in our TAC code. It's a linking definition, but essentially it covers what those services can look like, that they're usually in homes, apartments, and in the community living environment in those spaces, and can occur for a brief period of time. It's meant to give that caregiver or provider a break. There's also our TAC code, which talks about crisis respite services, and in response to a crisis for individuals. They're meant to reduce or manage symptoms of mental illness, and prevent an individual from, again, seeking that more restrictive placement. There is also a DFPS definition, and have I been muted this whole time?
No.
No.
Oh my goodness. Okay. There's a DFPS definition, which talks about a 24-hour care operation that provides, again, respite to provide relief to that care provider or that legal authorized representative of that youth or adolescent. And then there's also a yes waiver definition. And this allows, again, that break for caregivers to get that relief in the home or in that home space environment.
So defining crisis for youth crisis respite, crisis, as we know, is on a continuum and subjective to that individual. It can occur at various stages or levels. There's prevention versus intervention versus stabilization. So crisis, the relationship could be ended with a partner. It could be siblings and the youth arguing, and we know without a break, something legal could happen. It could be that the parent just needs a break from the child long enough to go grocery shopping. So it can be anything like that. It can be experiencing symptoms of anxiety and depression without a break from school or home, or these symptoms may increase. Maybe self-harming would increase, and normally a child would just say, something to get them hospitalized, even though they're not quite there. But they would, because there's no other option of a break. So youth crisis respite allows for a different kind of option. If they're engaged in behaviors that are dangerous to themselves or others, it might be a good time or a good place for them to take a break to learn some skills in dealing with behaviors so that they can be more successful at home. Or if they have a history of suicidal attempts or ideations or HI, it would be a good time for them to get away without having to use a really strict environment. Maybe home is the problem and they're doing really well at school and school is supportive for them. So maybe coming here and still being able to attend school, but getting that break they need from home would just keep the situation from escalating. So there's lots of different things that respite can be used for, even providing a pre-planned respite. We know that if this kid doesn't get a break at least once a month, then a crisis may occur. So pre-planning for that to be preventative. And so there's lots of different ways to use it on a continuum.
So some of the best practices that we utilize for youth crisis respite delivery include a trauma-informed environment. I'm sure this is a big sort of topic word right now. We recognize that trauma exists, that there is some compounding symptoms. And what we want to do is create that space that acknowledges that and supports that and creates that overall awareness for the individual when they're occupying our home. It's important to have community collaboration. This is going to be a really big one that we're going to continue to also talk about in our webinar. So we need to have the support of the individuals in our community stakeholders, our community coalition members, because together that's sort of how we address those needs for the adolescents and those sort of hindrances that they may encounter. Because it's through that continuity of care and community collaboration that we're able to sort of address those issues once they exit the home. Staffing and funding, this is a really big one also. So staff need to be present during all shifts. And so having a QMHP present or available and at least 2 direct care staff per shift is best practice, at least in our situations they were. And getting creative with staffing is also key. Our admission process, that's also a really big thing. So finding an admission process that works for you, creating that fluidity with your agency and that community. And it can vary. So every agency, every organization and community works differently. However, for both of our centers, it must be approved by a director and LPHA, depending on our center's policies and procedures, to ensure that that student or that individual is clinically appropriate for that space and that milieu in the home. And then there's continuous quality improvement. So we are constantly looking for ways to improve programming. And so working with adolescents, and I'm sure working with crisis, you all know that it's constantly changing and evolving. And so it's keeping us on our toes, and we recognize that our program has to continue and grow and develop to meet those behavioral or mental health needs that are seen in our community.
And then what are the benefits? So flexibility in programming to allow for the needs of the youth and family. Creativity is key in making a respite work. Each individual and individual family is different, and being able to wrap around and be creative for the family and youth to have voice and choice in their treatment is definitely key. Again, ability to reduce crisis episodes and allow for more individualized care. What works for one youth is not going to work for another, and being open to working with each family on an individual level. Community, it's great for the community, reduction of rate for use of crisis emergency services, less time in the ER, less time waiting, and ability to serve your youth in the crisis and not after the crisis is key. A positive, sorry, the chat's coming up over the PowerPoint. Okay, positive attention, modeling a safe place to share, builds autonomy and empowerment. It helps with socialization skills. It provides youth a place to be who they truly are without judgment. And it's just a great way for us to model what a safe environment should look like. And then the use as a step down. It can also be used as a step down from a more restrictive placement and transitional planning. Sometimes a youth isn't quite ready to come home, either when they leave a detention facility or a psychiatric hospital, and it allows just a couple more days to meet with the family and the youth in a safe environment and do some transitional planning so that their return home into the community can be more successful.
And that is our presentation.
We know that was really quick, but we're going to have plenty of time the rest of today to ask questions. And then next week, we do the policy lab to really build on that. But that's just a really quick overview.
Thank you both so much. I think that was really helpful information. And as you said, we'll get into some more of the details of the development of a crisis respite center a little later on in the webinar. So thank you so much again. So we're also excited to be joined today by Janice Stanley, who is a family partner at Heart of Texas MHMR, and T. Lyles to share their thoughts on the importance of youth crisis respite. I'm going to pass the baton to Kelly so that she can provide a proper introduction for Janice and T.
Hey guys, so Janice Stanley is our family partner. She's been with Clare Center for Families, which is a part of the Heart of Texas Region MHMR, for 25 years, which is hard to believe because she's only 30. So she's been doing this for a really long time. But if I had a favorite family partner in this whole world, it would be Miss Janice. She is awesome and comes with a wealth of knowledge and experience. And we brought Miss Janice today because, as you know, family partners have lived experience. And unfortunately, at the time when Janice's youth was at home, a respite facility was not available. And so we thought it was important to talk about how a respite facility could have changed things for her and her family. And then we also have Tiana Lyles, who goes by T. Unfortunately, she's got one of those names that people struggle with. And so she goes by T, and T has actually stayed some time in our respite facility. And so we have T here today to talk about what was good, what was bad, and how it helped her in her time of need. So thank you, ladies, for joining us. We really appreciate your time today.
Thank you so much. Yes, thank you both so much for joining us. And so we just have a couple of questions here to kind of guide our discussion this morning. To start with, could you share just a little bit about your own personal experience? And we can start with Janice if you would like.
Okay, absolutely. Good morning, everybody. Thank you, Keisha, and thank you, Kelly, for the wonderful introduction. I appreciate that. 25 years is a long time. 17 of those years have been serving as family partners. So I'm very honored that you all have asked me to come and be on this panel and part of the webinar this morning. So, okay, so just a short version of a really long story would be that I have two children. They are both grown adults right now. My son is 33. He's the one that has received the mental health services. He was initially diagnosed with ADHD at the age of 6, and he was seen by a psychiatrist who tried various medications that really never worked. That was the unfortunate thing for us, is we really never could find anything that helped him with any of the symptoms that he was experiencing. He received counseling services. I was in counseling services for myself, and we also had family counseling. And those things were helpful for us at the time going through our journey. However, at the time, I was thinking that maybe that would fix everything, but no go. We just kept going. He struggled behaviorally as early as being in daycare. And all through his education years, he struggled with behavioral issues. He was always getting in trouble at school and getting in trouble at home with a lot of defiant behaviors. And I was also always getting calls from the school where he was being suspended, going to the alternative school, the Challenge Academy, and unfortunately had some involvement with juvenile detention. And so through the years, he did receive additional diagnoses in addition to the ADHD. And some of those are his anxiety disorder, the OCD, and the ODD, and a conduct disorder. In his later teens, he started refusing to take medications, which didn't help anyway. And that was what he was saying. And of course, as the parent, I couldn't really argue that fact because they weren't helping. They were giving him more side effects and more symptoms than they were being helpful for him. So he started using drugs and using alcohol to self-medicate. And he went through also a period of self-harm where he was cutting. And so kind of fast forward, he has been in 13 rehabs, in addition to recovery centers and a lot of hospitalizations for detoxing and sober living. And so through lots and lots of prayer and lots of support from family and friends, I'm happy to share that in November, he's going to be 6 years clean and sober. And he has a beautiful, beautiful 7-year-old daughter, my granddaughter. So it's been a journey, and sometimes the journey is not over. It's not like everything is perfect when they grow up, but things are tolerable, and he's learned how to manage and channel some of those struggles that he experiences.
Thank you so much, Janice, for sharing that. And I wonder, how might crisis respite have benefited you and your family had it been available to you all?
Wow. So many things I can look back and say, man, I wish this would have been available, that would have been available, which makes me really excited for the families these days that have more opportunities out there to get help for their families and for their youth. But in looking back, I feel that the option of having the crisis respite would have helped me with my high levels of stress, with his behaviors, as well as the stress that it placed on our family. As a single parent, it was tough to take care of kids and have a job and manage everything. And that was another thing, trying to work and getting the phone calls from school and, having to either talk to him or go up there and handle situations. I know you all have heard families say that repeatedly of how, some parents are just not even able to work at all. But it could have helped me also to have a break and to focus on my self-care and just kind of regroup. I remember just spending countless nights crying after my kids went to bed, just thinking, why isn't there more help out there for us? Why can't we get more support and get through this? But I think that there would have been a lot of peace knowing that there were respite services available where he would have been with professionals and safe. And I could have taken care of myself and just felt more relaxed knowing that these professionals have it for a few days and I can just be and regroup and, attend my own counseling or calling a friend or family member or what have you.
Thank you. Thank you, Janice. And as mentioned previously, T has experience in being involved with a crisis respite center. And so T, I wonder, what was your experience like in the crisis respite center? What were, some of the challenges, but what were some of the really good things that you experienced?
I actually had a really great experience with Respite. I never did want to leave, actually. I do think y'all should up the age limit to 21. I did not want to leave. I absolutely love Respite. Wish that it was available for all children that are going through stuff. Being at Respite, I had a chance to get a break from my life outside, get a break from school if I needed it. I had a place where I could come and be myself. I could vent. There were people that would listen and could give me advice and help me through it. I always had a bed to sleep in, a shower, clothes, anything that I needed, food. So it was a really good experience for me. And the staff here, they're amazing. I love how they give everybody their individual attention and needs and care to everybody, you know. And it is kind of difficult sometimes. You gotta be with different people with different situations, but you learn how to cope and you end up helping other people how you learn different things from different people. So that was a really good experience also. Maybe to take that into the real world and help other people with that.
That was good. You're good.
That was great. Thank you. Thank you for sharing that. And it sounds like it was a very a helpful option for you and your experiences. And so I'm really glad to hear that. Thank you for sharing. So our next question is, what do you see as the greatest challenges for families and youth in engaging in crisis respite services? So what might prevent them from engaging in a crisis respite center? What challenges might they face? I mean, I'll open that up to both Janice and T.
Most of the time when kids come out here, the issue is they don't want to give up their cell phone. And so to me, that was actually a really smart thing to take a break from social media. You actually get to clear your head. I thought this should be a cell phone free zone, but kids these days, the phone is their life, you know, so then they don't want to do that. But I totally agree with that. You know, sometimes they're like, I don't want to go to bed at this time, but you know, at the end of the day, it all helps and works out for the better. So that's really just, you know, kids don't want to give up their phone or go to bed at a certain time, but it works out.
Thank you.
That was exactly T. One of the things that I was thinking of is because social media is so important to all of us, not just youth, but for all of us these days. And it's hard to put that down and leave that at home and the game systems and stuff. Just to kind of add to what T was saying from a family partner's perspective and talking with families and visiting with families. They've shared their frustrations if their youth is refusing to utilize the service at Respite. And I know that can be very frustrating for the parent when they feel that it would be beneficial for not only the youth, but for them as well. One other thing, and like I said, these are not really major challenges. They're just little hiccups, little bumps, you know, that come along sometimes. But I've had parents state that they feel frustrated that their youth went to Respite, and after staying there a few days, they wanted to come home and they weren't there throughout maybe the planned time frame, you know, that had been set. So really not a lot of challenges, but we have had those few things shared with us.
Thank you. Thank you both. And what are some of the positive outcomes that you all see for youth and families who are able to take advantage of crisis respite?
You want me to take that one? Go ahead, T. Talk to us.
I do. What was the question again? Because I forgot.
Yeah, I know, you're fine. So what might be some of those positive things that come out of a youth or in a family being able to take advantage of and access crisis respite?
Some of the positive things is that you do get, I call them lifelong mentors. You get to take on some people that you can forever like call on and be able to talk to. And I lost my train.
No, that was great.
I'm sorry.
That was great. Thank you.
Just go ahead, Jerry. I'm sorry.
It's okay. I'm with you, T. I'm over here sweating also. This is my first time to ever really, you know, speak with virtually, you know, in a training. So anyway, we're all good, T. Just
great.
As far as visiting and talking with families that we serve, what we've seen is an opportunity for the youth and for their families to get away from stressful situations that may be going on. And I think Kelly kind of spoke to that earlier. You know, sometimes it can be stress between parent, caregiver, and youth. There are siblings. Maybe there's some things going on at school that have been stressful for the youth. And so, you know, having that access to respite, you know, would be a way to kind of separate from that. And we've seen it provides structure and supervised setting for the youth so they can stabilize their emotions. Also, first and foremost, is it prevents unnecessary admissions to hospitals. And that's one of the things that we're trying, hopefully, to intervene and, you know, get them some support that they need. It provides short-term assistance to the parent or caregiver, and they can focus on their self-care. I know I had mentioned that earlier. If self-care would, respite would have been available for me, I could have maybe regrouped and maybe have felt stronger to handle some of the situations. But I feel that parents and caregivers can be at peace with the respite, knowing that their youth will have professional staff that provide safety for them. There's counseling services that are available for them. There's a case manager that's available. And of course, they're getting good meals. Chase House is spot on with those good meals. And then also, you know, for youth to, you know, if they're on medication, knowing that that medication will be administered to them as directed by the doctor. So I can't tell you how many times that I've been out either with a parent or just visiting at the Chase House and didn't want to leave. I just wanted to stay right there and visit and chat with my coworkers, and it's just a really comfortable, like you all were saying early, living room environment. So
Thank you. Thank you. And just one last question, not to put you all on the spot, but I'm wondering if you all have any last words that you would like to share with participants in the webinar today who may be thinking about implementing a crisis respite center for youth and kind of want to know more, but are kind of on the fence. Do you have any kind of, besides you've covered a lot of kind of those positives that you know, really impact young people and their families in implementing crisis respite, but would you have any last kind of piece of advice or thoughts that you would like to share with participants?
I do. I feel like when it comes time to leave respite, like being out in the world after, you know, you've had a hard life and you have mental issues, like when you just put out in the world, you don't have a break anymore. I feel like that's the issue. Like, you know, the at least till like you're like 21, like up it, you know, that's my biggest issue there, right? Once you're an adult and you turn 18, you don't get a break or anything. You know, it's just life thrown at you, full blown. And I feel like that maybe that's something that we could work on. And honestly, I hope to see more respites around, because I feel like every kid should have a chance to get a break and get the chances that I got. Because it did really help me out a lot. I can't really speak because I'm nervous, but respite is a really great idea. And I feel like everybody should get this opportunity.
Thank you so much, T. That was great. Janice, do you have any thoughts that you'd like to share?
Not that I can think of. I think T covered, you know, kind of my last thoughts. And so good job, T. I think we covered it very well. Thank you.
Yes, thank you both, Janice and T, so much. This was very helpful. We always want to make sure that we're hearing from voices of lived experience, and to have y'all's expertise here today with us this morning has been fantastic. And T, you did great. Thank you so much. Okay. So we're going to spend the rest of our time this morning talking about kind of how to begin developing a crisis respite center from this panel of experts that you've met and that have done just that, implemented youth crisis respite within their community. So again, we're so excited to be joined by Kelly, Melissa, Jessica, and Teresa, who I introduced earlier. We're just so excited to hear from you all on your thoughts and experiences around developing a successful youth crisis respite center. As we go through this discussion, we invite any of you all participating in today's webinar to submit questions that you may have in the chat as we go along. Tracy will be monitoring the chat and will capture your questions so that as we have time towards the end of the webinar, we can answer those questions, or the panel can answer those questions during the Q&A session following their panel discussion. Okay, so to start us off, we know that there's a multitude of things that need to be considered as a community moves forward in developing a crisis respite center in their area, and provision of services can look different based on the community, the location, the youth and families that they serve, resource capacity, etc. So could you all provide your thoughts and insights on the importance of establishing from the outset a set of guiding principles that will steer your decision-making as you move through the process of establishing a crisis respite center? So identifying the milieu, the age of the youth you hope to serve, the environment in which you hope to provide respite services, as well as you spoke earlier to this point, Melissa, the importance of engaging community partners from the very beginning of the planning process. So, kind of speaking to the importance of developing those guiding principles to move you along in your planning process, kind of considering all the options that you all have, as well as engaging the community as you're developing a center.
Big question. It's a lot. Good one. So I just see something come through on the chat about kids and CPS care. So I think that's one of the things that you have to decide early on. So we are operating under an exemption for licensure from HHSC, meaning because we're with the local mental health authority, we are exempt from needing licensure. So that's how we operate. So you can also get a DFPS license, which allows you to be, in a sense, a shelter for kids who are in CPS custody. So DFPS right now, depending on what area you're in, will not utilize a respite that is not DFPS licensed. However, our experience has been a case-by-case basis. There are times where we have had youth in CPS care or who are in a CPS placement awaiting another placement and need a couple of nights. Instead of sleeping in an office, they sleep here. It really is a case-by-case basis. So it's not us saying no, it's DFPS and their rules. And so deciding that, first off, it's going to help you decide how many beds you have and what milieu you have. Melissa, you have anything to add to that piece?
No, yeah.
Or Teresa?
I think that's accurate, Kelly. For our situation, yes, it's been a case-by-case basis with CPS kiddos that are in CPS care. We do get a lot of kiddos that have CPS involvement, but those other situations have been more unique. And I believe Teresa can speak more to those unique situations because she had a great foothold and relationship with the FPS that allowed that to happen.
Thanks, Melissa. I think if I go back to those guiding principles, I think the guiding principle was that we serve children. We serve youth. And then any challenge we had, like a CPS worker calling and saying, hey, do you have room or space for a young person? The site was set on serving that kid. So then you navigated the system. And if we know the system, then we can navigate it on behalf of that child and family or on that CPS worker, et cetera, et cetera. So I think, in establishing that guiding principle for us, it was, we're going to serve kids, right? And we're going to help and we're going to intervene. And it doesn't matter if it meets DFPS criteria or if it meets HHSC criteria. What it needed to meet was kid, family, and community criteria, and we had to have the ability to implement it. When I think of milieu and age, some of that was just happenstance. right? You start going, my suggestion for anybody creating this is create large, create big, do the field of dreams, build it and they will come kind of thing. And Kelly, y'all can probably speak to that as well. You're going to get, what's the right word? You're going to have barriers as you go along, depending on your community, depending on your funding, depending on your administration, the communications in your own agency, how well you educate your community, right? We spent a lot of time educating community because this was such a different concept from what most people think of as respite. So I think sitting down and saying, what are our primary principles? We are always going to do this and always going to do this. So a good example is we may have had 6 beds, but there were often times that there were only 2 children in that home because one of the guiding principles is trauma informed, and the 2 people that were there, really, they needed their space. Anybody else who was being referred may have not been a helpful component to the 2 people that were already there, or vice versa. And so again, going back to who is the person we're serving and what is our guiding principle. And so I think, and Melissa and I worked extensively together. I think for us, it was always the kiddo in front of us, right?
Thank you. And then also you mentioned a little bit, Teresa, kind of the community education piece. So was it important as you all were developing this or starting to put kind of plans in place, was it important for you to engage community stakeholders in the planning process? And what did that look like?
Well, you know, Hill Country created this out of an 1115 waiver initially, and now everything's changed. So I think the timing was different. If I had to do it over again, I would do things a little smarter, stronger, harder, faster, and better. So getting into the community, I think I probably would have talked to them about the affordability, how it changes the finances in your community, how it takes pressure off of your emergency room, how it can be a financial savior as well as a social savior to this population and our communities at large. And that would have probably been my gig going forward, and trying to get some people on board to look at how this could be a resource and an asset that they would be willing to invest in, so that long term the investment paid off for the community as a whole and in a big way. Your police officers have to be involved, right? Like, you just don't even have an option there if the police aren't involved. Oftentimes kiddos would come to us because of an altercation at a home, and usually it was because there was stress or tension. And if we could delete that stress or tension for the evening, it was amazing how much things could resolve. So educating them on how a respite center could be helpful to them. Teachers, right? We did a lot of CASA work as well. And Melissa helped, I mean, because that was an ever evolving thing. We kind of had a rule, right? If there is not a child in the home, or if there is some perceived boredom or anything like that, the job is to go network and remind people we're there, what we do, seek out community liaisons, resources, and collaborations.
For Heart of Texas, we similarly had a grant through SAMHSA at the time. In our very last year in the grant, our goal was this crisis respite. We had one-to-one forever, never had the funding to do it. But during this grant time, we formed our OCOF, which is our Heart of Texas System of Care, our community, our future. And so through that, we brought community members. We brought everyone to the table. We started early on, probably 2 to 3 years before respite even came about, talking about respite. What would it look like? Here's the buy-in. What do you guys think? How can we collaborate? Then finally, our 4th year of the grant, we had just enough money for 1 operational year. And so we were able to do that, but because we had started the system of care in our area, we were able to get a donor and some financial buy-in that's helped us stay open past that, and it allowed us to finally buy our facility. And so there's a lot of networking that goes into keeping Respite open, a lot of grants, different programs, different community providers, helping with bed days, that sort of thing. So I would say for us, having a system of care specifically to our area before Respite even opened was beneficial in keeping us going.
I think as I'm listening to you, Kelly, the other thing that is really important is, as LMHAs, as community mental health, quite often we think about our current systems that are in place and what we can do in those systems. This is outside of those systems in a big way. And so it may look like a service that the LMHA provides or that HHSC provides through Respite, but there are a lot of twists, and funding is very difficult. It's just not easy to get funding. And so being able to find that funding is really, really super important. I think you also have to look at what your community resources are. Kelly, y'all are in a small catchment area. One of the challenges that Hill Country had and some of the other large catchment areas would potentially experience is that we served all 19 of our counties in 25,000 square miles with 1 respite center. And so that became a huge challenge in terms of transportation, but it was not economically feasible to recreate this. It was cheaper to have the SOs on board to transport, or family partners and parents to collaborate, to get funding for transport. Those things, at some point, I think Melissa and I even decided that our own staff would do some transport. But in terms of some of the questions I'm already seeing, every situation is different. There is no cookie cutter. None.
Yeah, no, there's definitely no cookie cutter. We brought to the table insurances, juvenile justice, our homeless drop-in centers. I mean, we brought everybody to the table we could think of. We begged, asked school districts, everybody. How you guys all agree that we need it. Now, how can we sustain it? What are your ideas? We have a committee just for sustaining Respite, and we were able to do that through our system of care. So it's really, creativity is key. Definitely key to keeping it open and serving. So we serve 6 counties, and like Teresa said, we do our own cleaning. We don't hire for that. We do our own cooking. We do our own transporting. We do things that people were like, oh, I'll contract that for. Well, we can't afford that and stay open. So being creative and being willing to go with those twists and turns, and looking under every nook and cranny and rock you find to figure out how you can serve youth in the best way and stay open at the same time. So there's a lot of questions coming through so fast.
Keisha?
One question.
Yes.
How would you like to moderate these questions? I can answer Andrea's.
Well, we're going to say we have a little bit of time after we get kind of through our prompted questions. At the end, we'll have a whole Q&A. Well, plenty of time for Q&A at the end. So let's go through a couple more of the prompted questions, and then we can open it up for Q&A. As you said, we have a lot of questions coming in for sure they're really great that we want to get to. So our next kind of discussion topic is around the building itself. I know that's a big question for many people. And so can you speak to some of the deliberations you went through and challenges you may have encountered in identifying your building, as well as the funding considerations that informed that process?
Sure. For us, we went and visited Teresa multiple times to figure out what would work best. It took us a year to find the building that we use. One, we wanted a ranch style home, so with a center commons area to try to help with separation. We also wanted it not to be in the city limits, but still in our service area. So we are in an unincorporated area. It takes out a lot of the process of going to the community, getting permission, permits for additions or adding things. It takes out a lot of those issues. And so finally found what we wanted after a year. And then from there, it took us about 6 months to be open and ready.
I think for us, it was, I mean, we were really kind of blazing the trail and what our administration kind of had in their mind versus what might be available or how we would incorporate programming into a location. There was kind of some disconnect. Really, I think what happened is that we got a gift from the heavens, and something came available within the same neighborhood as our mental health clinic. And it just happened to be previously used as a group home. And so there were 4 bedrooms in an apartment with a large shared living space. And it was vacant, had been vacant for a while. And community donation was made and it was purchased. So, you know, that came with its good and bads because we had this awesome place, but now, you know, I've got an LCSW, I don't wear a hard hat. And so we had to learn about fire code and putting in a big industrial sprinkler in the home and retrofitting for that and whatever else came along with it. Plus, because we're exempt from HHSC, like Kelly was saying, from licensing, because we're considered a crisis intervention through the crisis protocols in the LMHA contracts. Because we're considered a crisis intervention, we are exempt from the licensing, but I lost my train of thought. Melissa, help me with the...
But we still have to do what they tell us to do.
Oh, we still have to do an inspection. Yeah, we still have to do an annual inspection with HHSC and comply with all of those rules, in addition to fire department, zoning, code, all of those things. And so we had to do a lot of stuff with ADA to revamp that, not to mention just the aesthetic changes we wanted to make in general. Looking at the safety, how close it was to a road, where the schools were in relationship, what things were close to us, so that we had, for lack of better words, entertainment or activities for the children to enjoy within the community. Melissa did a super job really helping these children understand what it meant to be part of a community and what was available in communities for them. So that's also something to think about, because if you are farther out, being able to help a child integrate into a community or learn what their power is in that community becomes a little more difficult. Those not as accessible. So lots of things to consider. One thing that I never would have thought of is how the community where the home was would respond to us. And it was not initially a welcome reception. The topic on the street was that we were opening a home for hoodlums. And I'm just repeating the language that was used. So it took a lot. Staff spent a lot of time canvassing the neighborhood. When we had projects on the home that we needed to have fixed, we often looked for the local community members who could be in there, see those kids, and then also say, you know, I've been in there and it was a great little place. It wasn't a troublesome place. and have those kinds of experiences. So again, with that creativity, how can we just really bring this home into whatever community you're setting it into?
And I can say for us, our experience was a little different. Where we're at, we're by the volunteer fire department, and they welcomed us with open arms. Our neighbors were good too. The only thing they had is when we were renovating, they came over and they said, "Are you Magnolia?" And we said, "Absolutely not." They said, "Are you going to raise our taxes?" We said, "Absolutely not." They said, "Okay," and we've been good ever since.
Thank you all. Melissa, do you have anything to add or?
No, yeah, I was just going to add on that I will say that, our neighborhood, we continue to be a positive influence there. Christmas, the kids are making Christmas cookies, they're decorating and they're dropping them off. We carve pumpkins, they leave them on our neighbors' doorsteps. Our neighbors have been incredibly supportive, but we do a good job of cultivating and continuing those relationships in our neighborhood.
But supportive in a way that you might not even really think about. I mean, I can think of a time when I drove up to the Respite to come to work one morning, and the neighbor on the left, as you face it, Melissa, she has this beautiful garden and she's always outside working on it. And she's really big on recycling and making sure that things are composted properly and all of these things. And she offered to offer her garden up for an activity and help the kids understand how to compost and the importance of recycling. And so, I mean, you just never know where the help is coming from. It really is that community and village effort.
Thank you. And I know our next question is also a very big topic that we could probably spend all day on, and I know a lot of people have questions about. But we know that obviously funding concerns are an issue, and we're going to return to that in a minute. But I do want to touch on licensing requirements and reimbursements and the role that plays in the planning process. So could you all provide some information around the licensing requirements, the considerations you had to make around licensing, and how those decisions impacted your program policies?
Well,
Go ahead,
you
Kelly.
let Teresa start it, but I can tell you, we followed Teresa's steps for a very good reason, and we are still very glad we did. So I'll let her speak to that.
We did a few twists and turns. I'm one of those people who like to shake the gumball machine until gumballs fall out. And so I just kept trying new things to see if we could find the least restrictive path to getting this set up, because that's what it constantly felt like, is that we were being restricted by something. We had this idea, this plan, but then when it starts involving children and taking over the caretaking and all of these other things, our center initially did not believe that we needed to be licensed because this hadn't been done. We thought we could do it under the same regulations that we do group homes and have 4 beds, and it wasn't any big deal. I had the fortunate history of working in childcare licensing in another state. And so that just didn't settle with me in my mind. If you're caring for children, there has to be some overseeing government or restrictive agency just for safety. And so when I started investigating, we had the crisis protocols, right, that direct all of our LMHA crisis services. And so crisis respite was in there. So that was one option. Another option is to do what's called a GRO, a General Residential Organization, I think. And that's a DFPS designation. Another option would be to label it as some other DFPS designation, like a shelter or a 24-hour residential or things like that. With any of those choices, it sets you on a path to determining what your services are and how you get reimbursed. And when we looked at doing this as a GRO or licensing through DFPS, regulations on the crisis protocols are far more severe, stringent, rigid, safe when you're looking at a crisis facility. So that kind of made me sleep a little better for starters. So we took the higher, the more restrictive protocols. But that GRO didn't do anything for us as a mental health center. It just let us get a contract with CPS. And I can get a contract with CPS outside of being a GRO if you know your CPS folks, or if we work on legislation. And some of that I think is already starting to happen where, you know, DFPS is reorganizing and we're no longer dishes, right? So that said, those are really the two ways that you can go forward. That does trigger your funding. And so neither path will pay for what it takes to operate a facility. It won't. Average operating cost. Melissa, do you remember the bed rate? Was it 246?
246.
246 is what we established our lowest bed rate if fully staffed and filled. Our beds were filled. 246 would be a going bed rate. That's a far cry from a hospital night. Like huge. Right. So you would think you could find some funding somewhere if you could prove that out. And we did prove it out time and time again. Melissa has stats. We had agencies helping us all over the place, pulling stats so that we could defend funding and that kind of thing. But going through the mental health channel and not licensing, but being exempt from license gave us the ability to stay within our bailiwick of mental health. DFPS doesn't really focus on mental wellness. They're looking at primarily safety. And so when we went through having HHSC oversee and inspect annually using the crisis guidelines, that just allowed us to stay true to the mental health implementation. You can provide skills. We tried. Kids don't want them there. It's not a good intervention. They get them, but not in the way that you can build them. Unless you're really creative, maybe with group. And even that disrupts the milieu sometimes. So you can get reimbursed for doing a crisis assessment. If you're doing the crisis assessments there at the respite, right? So there's the struggle with that, and there are the channels for licensing. I probably just opened a whole can of worms.
That is completely fine. We are here to answer questions and to provide as much information as possible. So thank you. And you spoke a little bit about this, but I wonder kind of if you all could give a brief idea about kind of what your programming and those services and supports look like within the center and kind of what's involved with that, and how did you come to some of those decisions about what you would offer and what you would not be offering?
Start off. So yeah, I think for us, our respite center, we really center our programming around the youth. There's a lot of power and control that they take accountability for in programming, and I think that is what makes our program so incredibly effective. In the very beginning, they're sitting down with me. We're talking about person-centered goals. What's realistic and within their means? What do they want to work on? What do they identify as barriers? And then our direct care staff work one-on-one with that youth in identifying what their day looks like. You know, what activities are we using to support that goal? What engagements are they working on? Is it schoolwork? Is it academic? Is it social? Is it environmental? And so I think that because we take that individualized approach, every day for us truly looks so incredibly different because it really depends on the kids that we serve. Some kids, cooking is a huge life skill. Baking is, a supportive coping skill. And so we are in the kitchen, we are baking, we are having those supportive conversations, we are building that coping skill up. We are creating that strong network of support for them. And so for me, I always tell the kids, ask me and I will try to make it happen. If it's realistic and within my means to do that, let's do it. If they're like, I want to go to Paris, man, kid, I really want to send you there. I can't. But, you like travel. Let's talk about what that looks like as a life goal. Let's plan that out. Let's research flights. Let's talk about, budgeting, things like that. And so I always encourage kiddos to get really big, and our staff, our direct care staff also, since they're one-on-one with these kiddos, they recognize those needs before I do. So tell me what you want to bring to the table, and let's try to problem solve that together to make that happen. We have, we've talked about community stakeholders. We have a really good community support behind us. And so we've got a board that greatly supports what we do as well. And so I don't have a problem tapping on them and being like, hey, I've got this really great idea, but I need some help and support and sort of fleshing it out a little bit further, point me in the right directions. And a lot of times they're kind enough to be like, yeah, here's a great donation, or and so we get really creative when it comes to programming. And there's a lot of things that I often don't say no to. And usually it's the funding. That's usually why I can't make it happen. But for me, it's different every day because it depends on that kiddo and their needs.
I think the biggest lesson go ahead, Kelly.
No, I was just gonna completely agree with Melissa. Our day looks very different every day, and we try our best to create that balance on working on a goal that they have established at the beginning, while also truly giving them respite, what this is for and intended, which is a break. And so what our intentions are for meeting a goal or things we can quote unquote bill for might not be what they need at the moment. And so we really prioritize giving the youth what they need, even if that means we're not making the most amount of money for billing purposes. And so we just have learned, like Teresa and Melissa have said, to be very creative within those so that we can meet in the middle somewhere and make a little bit of money and give them what they need and want. And so that's in the kitchen, talking about life skills, doing math with measurements and things like that, or it's talking about, if they're just focused on my home life, it's not great, I want to get out of here, I hate being with my parents, whatever. Okay, let's plan for that. Let's look at what it looks like to get a job so you can support yourself, to budget. What is it going to take for you to support yourself to get out of this environment? Let's be realistic about it. Or there's kids that just want to be here and relax and love art and sleep. And so naps are great. And so napping is part of programming if it supports their needs at the moment. And there's kids that love to be artistic and draw. And we had a whole art room full of paintings and drawings that they would do, and we would utilize that as group activities to work through some of their mental health things, their depression, their anxiety, and let them really express those things. We have a garden that they participate in here on our property. We have chickens that we have taken in, and they utilize that as life skills. And we go out there and we have to feed the chickens and water the chickens and collect the eggs. And we talk about sustainability. We talk about composting. You just have to get creative and figure out a way to make it a life skill and skill streaming so that we can bill for it, while also providing all the things they need, and also make it an environment that they want to be in so that they can get this break and that parents can get a break as well. So, just constantly being creative and having staff that's willing to roll with the punches every day is what programming looks like, honestly.
I think one of the biggest, two of the biggest lessons that I had as we developed, and Melissa just ran with it and created incredible programming, was don't try to cookie cutter it. Don't try to do that. We just handcuffed ourselves so badly every time we tried to do something that was rote or cookie cuttered. We tried to save time and create processes for cooking or for groceries or things like that. And honestly, it caused a lot of problems, not only in our staff, but in the way we organized our days or what the kids needed. And so when we finally just said, this really does need to be just like a home, where if you need milk, you all get in the van and let's go get some milk, right? And that now it becomes part of your day. And so realizing that you have to have that kind of flexibility every day, super important. I think the other thing that I learned from all of that is that allowing for that flexibility, people would vie for the respite staff positions. I mean, there was always somebody who wanted a position at the respite house because it's a fun place to work and people like being there. So something to be said for that too.
Thank you. And y'all have talked a little bit about and really mentioned how your programming and kind of the day-to-day is really driven by the young people that are in your care. Could you talk a little bit about the role that Family Voice has played in your programming and kind of what things look like within your centers?
I can speak to, well, first off, we have our kind of formal process of getting that family voice is that we have surveys that we provide to both the youth and the parent, caregiver, whoever it is, after each stay at respite. And so even if a youth has utilized us 10 times in the last year, every single time they stay at discharge, part of that is that they're going to fill out a survey talking about kind of their situation, what are the other resources they would have used, what do they like, what do they dislike, any changes they would recommend. And so we're getting the formal way we get that is through those surveys. But we also have great relationships with our case managers, with our family partners who have those constant relationships with our families after they're here, right? So we only have them for a few days at a time. It's hard to really get a lot of feedback and actually make changes within that time. But we have relationships with those case managers, counselors, family partners that are able to give us the feedback from parents. And so things like, you know, I wish one of the things at the very beginning was, well, it would be really helpful if I knew when my kid could utilize respite or when I could send my kid to respite. And so we started implementing planned respite, you know, where, okay, every third weekend of the month, you can come bring your child, get a break, and that helps alleviate some stress of the parent knowing that that's planned out. Or different things like kids would talk with us about how we used to have an art room and we had to utilize that for a bedroom because we expanded. We got a lot of feedback from youth saying that really miss the art room. It's not the same. I know we can still do it, but it's not the same if we can't see our art. And so we worked on that and we tapped into our system of care and we got a donation for an art house so that we can have a specific designated place to do art and activities and things like that, because that was very important to them, we found out. We also do a 7-day follow-up and a 30-day follow-up with our parents and guardians just to check in with them. So our nurse does that. We have the capability of our nurse taking that on, and she does a wonderful job. And so we reach out to our parents 7 days after the child leaves respite just to say, check in, see how things are going. Do you guys need anything? Have you followed up with your case manager? Those kind of things. And then again at 30 days just to make sure they know that we're still here. We still want to provide you guys services. Can we connect you with anything in the community? And also just let us know if you're ever ready to come back and if you need us. And so those are ways that we continually are getting their feedback and changing programming based on those things.
Yes, we do all, very, very similar things. We incorporate surveys from parents and kiddos. We do continuity of care follow-ups as well with family. Our discharge process, we are bringing everybody to the table that is plays a supportive role for that kiddo. So if it's cousin, if it's aunt, mom, a family partner, I want every adult at that table that's going to be a supportive role in that kiddo's recovery. Another thing that I thought was also great that we do that hasn't been touched on yet was that we include family in actual respite. So a lot of times parents come to lunch, they come to dinner, we are sitting at the table all together having a conversation because that's what they usually do at home. And we want respite to be we don't want it to be intrusive. We don't want it to be restrictive. And so parents will come and they'll just check in and, they'll bring ice cream. and they'll have like an ice cream Sunday party, or, you know, it's Wednesday spaghetti night and we're all sitting at the table playing, you know, after we eat dinner, we're playing Sorry together. And so including them in that process is always, I think, really great for parents because they get that insight. And one of the things I think that I hear the most and our team hears the most is that they don't act like this at home. Like, I cannot get them to clean a dish at home. Like, I cannot get them to pick up a broom. And I'm like, really? Like, you know, there's very little pushback here because I think it's, again, it's that community culture where they are valued. They are part of that team. They are built into that. Like, this meal would not have been happening without them. You know, we value them being there. And I think parents and caregivers getting that insight is just incredibly impactful for them. When they go home, you know, it gives them maybe some ideas of how they can begin to restructure routine, expectations, how they communicate, because they see that it is possible.
Yeah, we do that as well here. We also, when we have yes waiver kids, we also have RAP meetings out here that is what the family would like to do, and include them and include staff in those as well that youth has been utilizing respite. So they can bring their pets. Well, the parents can, or the LERs can bring their pets to visit. They can't stay. Also, if they, for some reason, are there and just want to sleep in their own beds at night, but still need the break during the day, I mean, we're open to being creative. Okay, well, sleep in your bed at night. You can come back in the morning and we can continue with respite services. So there's lots of different ways that I think we include family voice for sure.
And I see a lot of questions about that kind of thing in terms, and so I think we can kind of put them all in the same group, that every child, every situation is going to be different. How long they stay, whether they stay for an hour, for a night, just days, go home at night, just a weekend, 2 days during a testing period. I mean, it just changes. Grandma's coming to visit and we just don't want to be around. So, you know, we can't get up, all kinds of stuff. I think that the key again is to be very flexible in hearing the needs of your families and the kiddos, offering what you're able to, serving that person that's in front of you, and going on from there.
Great. Thank you all. I mean, again, as you said, it sounds like a lot of creativity and flexibility and just the ability to adapt and move forward as things come up and arise is very critical, as well as, again, that community collaborative and thinking about long-term sustainability and getting buy-in from the community sounds very important. So thank you all. Those are our prompted questions. And so I'm going to hand it over now to Tracy Levins and Arnold Amador to lead us through our Q&A portion. Again, if you, as we kind of go through the Q&A portion, if you have any questions that you would like to ask of the panel, we ask that you just put that in the chat and we'll get to it as time allows. So thank you all.
Hello, everyone. First question that I have right now, let's see, is there exclusionary criteria for children who are eligible for respite? You know, aggressive or other diagnoses such as IDD, autism, etc.?
So I think that goes back to whatever your initial policies are and how you're structuring your programming. But it comes down to a crisis evaluation. One of the key pieces here is if you license through HHSC, this is a crisis facility. So there must be a crisis evaluation. And then that determines least restrictive intervention for this kiddo. So the times that it would not be appropriate is if hospitalization was appropriate, right? We couldn't keep them safe. The other times it wouldn't be appropriate is if the milieu was in a certain formation that bringing that other person in, or any of that kind of stuff, then those would not be appropriate times. So the kid may be appropriate for respite, but respite's not appropriate for the kid.
Nice.
See, specifically for us, we do have a medical director who has determined that there are some medical reasons why a youth would not be appropriate for respite. But again, it's on a case-by-case basis, and we always consult with our medical director first, or our BSN who's on staff if we have concerns. We do have an IDD respite here in our catchment area, but a youth with autism, as long as they are able to do the daily living activities and self-administration of meds with, of course, staff watching over, making sure they're safe, they would be able to utilize respite. But otherwise, it's kind of based off that crisis evaluation. There's not anything as far as aggressiveness. It's always going to depend on who that is with. When's the last time it happened? What does that look like? Kids who are on probation are more than welcome here. It may be that the milieu isn't correct at the moment. It's not because they have a charge, it's because of the milieu. And so we just work those out as best as possible. But again, there's no cookie cutter for who comes.
Thank you.
And I will also have to say that as much as we tried not to have bad days at respite, there are bad days at respite, and there were days that we had to call a parent and say, I'm sorry, we can no longer have your child here. Right? This is no longer inappropriate. We can do a crisis intervention. We can, or a crisis evaluation, and we can look at hospitalization, but many times it was behavioral. Hospitalization was not appropriate. And one of the big rules in our home was if you start destroying the property, then you can't stay.
Yeah, Teresa, I think that's a good point. We always remind them it's voluntary both ways. We don't take anyone who's court ordered or mandated to be here. So if you want to leave, let us know. There's no reason to run, to break things. We will get you where you need to be. But also, if you can't follow these steps or these guidelines, we can also ask you to leave. And so it's worked out really well for us. I think
it gives them a lot of power and choices.
Yeah.
And then the staff is always reminding them and helping them refocus on their goal, which just goes back to, you know, that living room environment, that household feeling.
Thank you. Before I ask the next question, I'm going to ask first Jennifer Evans, who's one of our participants. You asked about more details on the financials. If that question has not already been answered, could you put a little bit more detail about the nature of your question in the chat box, and we'll get to it afterwards. And meanwhile, while you're doing that, Andrea Richardson asks, are the programs measuring and presenting outcome data to community partners informing the benefits of respite care?
I think one of the most awesome things about the Hill Country Youth Crisis Respite is that it was formed under 1115, which meant that we were required to learn CQI and do continuous quality improvement. And that has remained a focus of that respite center. And if you're not doing weekly continuous quality improvement, you're going to have some difficulties. But the statistics were collected as well. And Melissa actually could speak to some of that, but on average, I want to say that it was in the 60 to 90 percentile that kids would have gone to the hospital, run away, hurt themselves, or been locked up if we had not been present. So.
And I think for us too, we reached out to Hill Country. So we started early on at the very beginning, like we know that they're super successful. They're doing this, so we want to do it too. So we started, and we also keep what county, what city, what school district, if they're homeless, if they're not, if they're part of the LGBTQ IA plus community, like we keep it all, and it's helped us tremendously. If they're on probation, if they're in yes waiver, if they have DSDS involvement, like it's wonderful.
Yeah. I think it's important that you designate one specific person to be responsible for that data collection. and make sure that it's being consistently collected. I mean, daily, weekly, because, you know, with the nature of everything that happens here, it can get behind real fast. So being the person that is responsible for that here, I have developed a system where, you know, that data is collected at the day of discharge or the day after discharge. I'm making sure all of the data is entered, qualitative and quantitative, into our system so that it's always up to date. Because I mean, I can't count the number of times we've gotten a call from executive director like, hey, I need these numbers right now. And you know, if you don't have that up to date, it's really difficult to present those kind of things. So just making sure you're constantly up to date, and it truly does make a difference. I mean, they pull numbers for us to write grants to keep us open all the time. Mm-hmm. And so having that data up to date and available all the time is very important.
But also doing follow-up work. And I know that as community mental health, we often struggle with our crisis follow-up work, but as a respite center, following up with your kids and having somebody on staff that maybe was important to them, call and ask to talk to that kid, right? How are you doing? How's your plan working? Right? Have you used any of those tools? Those kinds of things. That gets out super quick, and then kids know that they have a place if it's needed. And we've had kids ask their parents, right? So.
And they will rank you. They have started ranking us from favorite to least favorite. So you know who needs to be the one to follow up. They'll let you know.
Yeah.
I just wanted to add in, what we'll also do is we'll compile that data usually annually at the end of the fiscal year to create a new one-pager to pass out to our community stakeholders. So they're aware of programming, what that looks like. And I also just want to say, like, every year I learn something new, like I should be collecting this and knowing this. So in my last 2 years, what I started tracking was reasons why kiddos were not admitted to respite. Like, I wanted to know why I couldn't let this kiddo in. Was it a milieu issue? Was it a transportation issue? So that way we can better problem solve that in the future, because what I don't want is, you know, us turning away kiddos that are in that need. And so how to better problem solve that. And so that was something I recently started tracking that I hadn't been initially.
Yeah, there was one thing that I thought of, a lot of questions about, you know, metrics and contracts and those kinds of things. Yes waiver, that's an interesting little beast. So for a long time, yes waiver could only contract with DFPS licensed providers for respite care. And so our own LMHA respite was not eligible for yes waiver reimbursement. My understanding is that that has since been corrected. And so there may still be some old information out there, but you can get reimbursement for respite from your yes waiver as a planned intervention. The struggle is that the reimbursement is nowhere near the cost of service.
Right. And I was a former yes waiver director. So when I took on respite, I threw a fit. I will openly admit I threw a temper tantrum, probably needed respite myself. But once it was covered, man, it doesn't cover a bed day, but any help is better than no help. Because yes waiver kids, man, they're intense. They're in yes waiver for a reason. So but it's been a blessing to be able to have them here.
I think the other, you know, we talked a lot about community and educating your community. Our community caught on quicker than our staff and our agency. And so educating your staff and keeping that going, because as staff leave, they don't know what the crisis resources are. So depending on how your center works, if you're, you know, if you have a crisis team that is really solid and stable, then you can provide them with the information and they can use respite as an intervention. But trying to get all of our 11 clinics and community members always knowledgeable about respite, what it does, how it can help, to get it on service plans, you know, to have it out there as an option for our yes waiver kids, those kinds of things. And so it gets lost in your own agency. So don't forget your own agency as one of your audience members. Okay, the cat just knocked over the computer, so my apologies.
Arnold, do you have the next one?
Yeah, so I want to combine these two questions because I believe that they're like in the same vein. Specifically, what is it that you do with youth that are enrolled in school, and how is it that you handle their education plans?
Yeah, so school has become, is both a resource and a challenge depending on the youth and the situation. Like we've said a million times now, every situation different, every youth is different. And so here at Respite, if school is not one of the issues and one of the things that is triggering the youth in the crisis at the moment, we try to get them to participate in school in a variety of ways. And so we have a good relationship with our closest school district, which would be Waco ISD, and they do a great job of being willing to send out a bus specifically for youth that are here at Respite so that they can be transported to their campus. If that's appropriate. And so we work with building relationships with those school districts so that we can call the bus barn and say, hey, we need a pickup today. We have a youth going to this school. And so if that's appropriate and we can get it worked out within the time that they're here and school's not an issue, they're going to be going to school and then they'll be utilizing Respite in the evening time and continue on with programming as normal while they're here. Because we serve 6 counties and it is a big, big space to fill and not enough transportation assistance. If we have a youth that's in a county that, sometimes can be 45 minutes to an hour away from our facility and transportation is just not realistic, we're gonna do our best to work with parents, case managers, the school to either see, can we get a computer sent out here? Can they use a computer here in our facility and log on and do schoolwork online? And then we have our staff assist with that and monitor them while they're doing that online. Or some school districts are small and don't have that capability, and so we go old school and we say, can you fax us worksheets? What can they do to get some schoolwork done here so that being behind isn't an additional barrier once they leave Respite? And so we have sheets sent here, emailed over, faxed over, and so we help them with that and we upload it back to the teachers. We just try to get as creative as possible. Because we serve so many counties and so many school districts, we don't have a cookie cutter way of doing things. We just work our best to get the schoolwork done while they're here. With that being said, if school is part of the issue, it's not a requirement. We explain that to parents ahead of time. We are not going to force your kid to do schoolwork while they're here. If it's going to cause a further crisis or it's not part of what's assisting them in the moment, we're not going to force them to do schoolwork, with the understanding that parents and the youth have to know that, okay, maybe you might need a few days of respite, and that might mean that once you get back to school, you have some catch-up work to do, and everyone has to be in agreement of that. And so we just have those conversations during the intake process, during the assessment process, and making sure everyone's on the same page, and we meet their needs as best as possible.
Yes, we operate very, very similarly. Every kiddo school situation is unique and different. And so we do have good relationships with our local ISD that will provide a bus. We have a bus drop off right down the street. They'll go to school in the morning, they'll come back in the afternoon, and it's a beautiful day. But we are a very large LMHA that serves 19 counties. And so we get kiddos sometimes 3 hours plus away from home. And so attending school every day is not an option. And so we'll get that homework sent, or they'll have like an online learning portal, Blackboard, that they will work on, that will sort of structure that throughout their day that they can work on that with. And sometimes it's old school. I'll have parents that have utilized Respite before. They're like, here is your stack of homework. I've already gotten it for you. Make sure they work on it. And we're like, thumbs up, we got this, we will do that. I always let them know I haven't taken algebra. It's been like forever. We will try our best. We do not know biology anymore, but we make it work the best way that we can. And so again, it's that flexibility and getting creative with each kiddo situation because it's so incredibly unique.
I think also, I just want to give a shout out to all the schools that we worked with and all the teachers and counselors. We had counselors FedEx books to us overnight. We had counselors drive books cross county to us. Just do whatever they can. I will say my learning moment in all of that is hold your parents accountable for that connection and getting that schoolwork. and communicating with teachers and stuff. Don't take over that responsibility. But all of the schools were very good with helping us so that that child could stay on track and get what they needed. And all of them accepted, you know, an excuse note as from us as a mental health need.
And I will say we operate the same way with after school activities, sports, and in church activities. We foster those. We want them to be involved. We'll have staff that will attend football games, sign them out, and take them back to respite after games. We don't want to take away any support that is helpful to them. We want to be as flexible as we can, depending on who all we have and the staff that we have and the funding that we have. But we always, the same way with Melissa, just ask and I will do my very best within my means to make that happen.
Thank you. I'm really hearing the key words of creativity and flexibility, and is kind of the thread that goes through all of the responses so far. Our next question is about, can you talk about the staffing ratios and the types of staff during different shifts of the days and nights?
So we
I can
have
start.
two staff. Oh, sorry, Melissa, go ahead. We have two staff. We do rotating shifts. We have during the day, weekdays, Monday through Friday, we have a BSN, LPHA, a licensed clinical social worker, registered nurse, and a qualified mental health professional during the day. And we will soon have 2 direct care staff during the day. At nights or mid shift, 4 to we're changing our staffing pattern in the midst of, right now it's 8-hour shifts. It's about to turn to 12, but we have at least 2 staff to 3, 6, 9 beds, 24 hours a day, always awake, 7 days a week. I think that's the best way to explain it right now. Short answer.
So we're very similar. We have, well, during the work week, Monday to Friday, I'm there, and our program manager is there to provide additional assistance and support to the kiddos and families, or do any outreaching needs presentations. But our direct care staff are scheduled 2 per shift. So we've got a day shift, which runs 8 to 4. Then we've got our second shift, our evening shift, which runs 4 to midnight. And then our overnight shift runs from midnight to 8 a.m. And so our direct care staff are 2 per shift. We are a 7-bed home. And so like Teresa mentioned, typically we don't max out at the 6, 7 bed. On average, I believe we have, if I could half a kid, if that's possible, when I did the numbers, it's 2.5. That is our average census for our home currently. And we do admissions. We admit 24/7. So especially for those kiddos that are discharging from hospitals or inpatients or step downs, as we know, crisis doesn't happen, beautifully at, 10 a.m. on a Tuesday. It's usually Fridays that's popping off with crisis. And it's usually in the evenings. And so we admit 24/7. All of our staff are cross-trained, so they know how to do an admission. They know how to inventory everything, paperwork, things like that. And so we do admit across all 3 shifts, and on the weekends and on the holidays.
We are the same.
Okay, so the next question that I have, where can we find the HHS requirements for the things that are checked, inspected annually, and how long is the exemption for right now?
The exemption has always been, it's part of the contract. Kelly and Melissa, I don't have access to that. Where did that exemption come from? Is that part of LMHA contract? I'm thinking it is.
Yes, and then the line item B is I've been referring to it lately as your Bible. Line item B is your Bible. That's what they're going to look at to find every single step that you need to do. It's recently been updated, thank goodness, to include child and adolescent. So we're not trying to operate out of an adult world. And so it also includes the general residential operations. And so you'll read down and then you'll get to a spot that says GRO, and that's where we stop reading. But if you want to be DFPS licensed, then you would continue on down to read all of it.
So
And it
the,
looks like Angela has posted it.
the
Thank you.
crisis regulations are what drives, if you're choosing to be exempt as a DFPS entity and a child care licensed entity, then crisis item V5, whatever people call it, is what you look to. And there is a section specifically in there for crisis respite services. And I think, and I know Kelly and Melissa both have it, but the state, when they started doing the inspections for us and put it all together, they created an Excel spreadsheet for us to go off of. So they send that to us every year, just as a reminder of what we're required. And there are some things that as a mental health provider, you wouldn't even think about. Like having somebody who's a food safety handler within the center, thinking about how you're going to provide food. We found it to be something that needed to be just like in our home. And we go to the grocery store with the kids and they help derive the menu and create dinners at night and show off their talents, whether it's washing or cleaning or making stew, or budgeting. So there's all different kinds of ways that stuff happens. So just keep an open mind. But with DHS, they did a really, really good job at trying to support us, give us opportunities to repair some of the things that they didn't find as safe as maybe we did, or to look at things differently. And they've always been very open when we talk to them about why we did things certain ways and they maybe saw it a different way, and finding something that is affordable for your center to be able to do and still comply with the regulations. So they even have taken a very individual approach, I think.
Yeah, and I think it's good to mention, I just want to make sure you know there you do have to, even though it's built into the LMHA, you do have to send in an application. And it's just a one-page thing. It's really simple, but you do have to send it in. And they do have to come out and do an audit before you can take you. So you can't just go find a line item, set up your house, and start serving people. There is a process, so make sure that you're aware of that.
That's a good point, Kelly. I had forgotten about that. It's been so long, but there is a one-pager that comes out of HHSC, and you just say that, yep, you're choosing to use the deferred licensing option and follow this oversight.
Thank you.
I'd say a quick word of advice is, if whatever's in line item B, if it's saying this is the things you need to keep record of, these are the things you need to do and monitor and all of that, have it in your policies and procedures the exact way that line item B states, and then have physical proof that you are doing that. Not just saying, yeah, we do this, but actual having a form for every single thing. It's made our life so much easier that we can just pull out a sheet of paper and say, we check these things daily. Here's our daily signatures. We check these things monthly. We check these things quarterly. Here's all the paperwork. And it has made our life easy that they're like, oh, okay, great. We don't have to ask any further questions. So just getting ahead of the game and having physical proof of all of those things they're requiring of you would make your life a lot easier.
That's some really good information that y'all are sharing. And I heard, Teresa, I heard you talk about at the beginning that suddenly you're having to put in a fire sprinkler when you didn't anticipate it. Were there any unexpected safety challenges, either in the setting up or the actual implementation, where you're actually having kids in the house?
That's a really great question. So the fire sprinkler, I think, was a big old waste of $50,000, but that's just my opinion, not the fire department.
We did not have to do that.
And they did not.
We have
they
not
went out of
had to do
county.
that.
And so
Yeah.
they learned from our mistake, is what they did, which was super. So I think some of the challenges that came up for us, ask your question again, Tracy. I'm sorry. Safety, right?
Yeah.
Licensing.
Unexpected safety things that came up either in setting up the house or in serving kids in the house.
So there's two that I can think of. One is, if your kids are going to go to school, make sure that you do some kind of a soft check on what they take to school and what they bring
Yes.
back. Amen. Right? Because
Yes.
that was just an oversight for us. And Melissa sat at a table and a lovely 15-year-old handed over a razor blade that she had taken to school for a whole week. And we didn't know it was there. So, I mean, just little things that you might not recognize. You think this backpack's in your office and it's going to school and it's coming back. It needs to be checked, right? But we still have to have that trauma-informed approach for soft checks and asking kiddos if they're being safe and those kinds of things. So it really is a collaboration with those kids. So that's one thing. The other is staff education. I remember we went around for days. Staff wanted to make sure that there was a trash can liner and in all of the trash cans, because in the bathrooms, right, it's not a pleasant experience to clean out those trash cans depending on who's using it and what's going in it. And so we had to have a long discussion about the fact that a grocery store bag could not go into these little trash cans in the bathroom because that was a safety hazard. And staff weren't really recognizing that as a safety hazard because, again, it's a lesser restricted environment. And so you want to keep it as much homey, but with that Christmas tree. The Christmas tree was an interesting, right? It has bows on it. That's it. It's got a whole bunch of bows on it. You know, so little things. What else, Melissa?
I would say we learned early on, we can't do balloon animals. So that was a hazard. The cords from our ceiling fans, we removed those. The faucet, the stoppers in the bathtubs, we have removed those. The cords on the blinds. You just don't think about stuff until you think about stuff, and then you start going around. That could potentially be an issue. So it is a least restrictive environment, but that doesn't mean that something can't happen within the environment. So going through your line item and then really walking through even your handicap bars. Do you have a plate underneath those so that a towel can't get from them? Do you have shower heads that detach, because that's not safe if they have a cord? Do you have shower bars that completely fall? Don't have curtains. Do you have doors? Do you have locks that you can pop open? All different sorts of things. And so if you don't know, ask. That's the best advice.
I think the other thing that becomes a big question is just food. And that could be a financial or a licensing issue, depending on what your choices are. Again, the Respite Center in Hill Country, we go to the grocery store, buy food, everybody cooks, somebody has a food handler's license to comply with the health department regulations, and they come and check our home kitchen on an annual basis. And they're okay with a traditional home kitchen. But if we wanted to, we could hire out that. I mean, there's all different kinds of things that you could do. If there were more than the 6 people, if we had a larger facility, it would have to go to a commercial kitchen. One thing we did run into was that, and this did become a big issue, our fire department required a commercial hood even over a residential stove.
And ours did not. So that's just a case by case.
Yeah.
Oh,
I think we have time for, yeah, I think we have time for a couple more questions, Arnold, if you want to go on.
Okay, I thought this one was interesting. Well, I think they're all interesting. Sorry, I don't mean to highlight. Can you support youth who need medication injections?
I think that depends on how you staff. So here were kind of our guidelines. If a kiddo needs medications that they cannot provide themselves, right? They like if a child has diabetes and they can self-inject, they're welcome to come. because self-administration of medication is part of the recipe at Respite. But if we have a kiddo that needs an injection, then we're going to try to figure out how to get that done, either by taking them over and having a clinic appointment, even if it's not the clinic they typically frequent. We'll still facilitate some kind of a meeting at one of our clinics. If it's a private provider, then maybe we ask the parent to come pick them up and take them.
We have a nurse on staff who can give injectables, or we go to clinic. Diabetes is one thing that our medical director has said is exclusionary, just because there's so much that goes into monitoring diet and blood sugar if they need an injection. So what we offer in those cases is day respite. Then they go home in the evening so the parent can help administer those meds, and then they can come back in the morning, and that's worked well for us.
Sometimes it's just try what you think will work best, evaluate it on the backside, and try again.
So I'm going to combine a couple of questions because all of a sudden I think, oh, okay. I was afraid I was muted myself again. So thinking about whether families have to sign consent forms, and do you require that the child's living with have legal custody before they can stay in respite? And also, if you've got kids that are couch surfing due to homelessness, can you accept those kids as well?
Yeah, great questions. So I will give our blanket statement first with the caveat that we've already said that every situation is so different and we just do our best. So in general, yes, our preferred way to do admissions is that we have a legal authorized representative, whether that is a biological parent, grandparent, foster mom, but that signing them in, signing all the consent forms, agreeing for them to be here at Respite. However, how we operate is that technically we don't have a way that they require proving that. So generally it's the adult person that they're living with that we ask come and do the admission with them, because we know that within the population that we serve, there's so many complexities of where our children are actually realistically living and who is taking care of them. And sometimes that's not the person that's legally supposed to be taking care of them. And so we don't want to use that as exclusionary criteria when these youth really do need this opportunity and these services. And so what we try to do best practice is have the adult that's caring for them, that is responsible for them, come and sign them in. However, Texas code states that at the age of 16, you can sign your own consents for mental health services. And so 16 and 17-year-olds technically can sign themselves in legally. And so if parent is not available, that does give us a little bit more opportunity for flexibility, that a youth can come and sign themselves in and out of respite if they need it, and parents aren't available or LARs aren't available. When it comes to our homeless youth or youth that are couch surfing or living with a variety of family or friends, we do our very best. I'm going to say 90% of the time, we're going to figure out a way for them to use our services. So we are calling someone, faxing over paperwork, emailing, having school connect with an adult, like whatever we can do to get an adult in agreement verbally, electronically, whatever we can do to get an adult to approve that. We're going to do it so that the youth can utilize our services. Most of our homeless youth are within that 16 to 17 range, and so that alleviates a lot of that. But we certainly serve them, and they learn quickly how to reach out to us when they need us. And so we've become a big resource for them as well. Am I missing anything on that? No, I don't think so. Yeah.
I think one of the big keys to remember there is that, darn it, I forgot my train of thought again. I was listening to what you were saying, Kelly. I'm so sorry. That it's crisis services, right? So when we start thinking about regulation and we start thinking, can we do this? Can we not? This is all under the crisis spectrum. So needing legal authorization, always a good choice, but we can always fall back on the fact that this is a crisis intervention, and sometimes those things aren't available, and so we just do the very best we can. I think one of our protocols was to always counsel with our agency attorney before we did those things. But I mean, yeah, just look at it.
Melissa, did you have, I'm sorry, Melissa, did you have something you wanted to add?
Go ahead, Melissa.
Yeah, sure. Yeah. I was just in regard to, you know, parental consent and, you know, law consent. I'm a big believer that this is a two-way street with a kiddo. There needs to be that buy-in from that family, that guardian, that support system. So our admission process is pretty lengthy. And we let the parent know I'm a big believer in the home of transparency. This kid is going to be held to the expectations. We're going to work towards getting that crisis resolved, but there's also buy-in on their end. And so I want them to know that it is a voluntary program, but there is that involvement that I expect from them as well at discharge, or maybe coming for lunch or things like that. And so we do really try to get the family involved at admission. And, you know, at age 16, they can consent to sign in and come in on their own. But again, I want that, if it's available, I want that guardian involvement. And so that buy-in, I think, is just so incredibly important for recovery and working past like hardships. So just wanted to add that.
Thank you so much. We are out of time, but our final question that I wanted to get to was, how many children and families are y'all able to serve each year?
So
Without
we have.
without having the Excel spreadsheet right in front of my face, it has varied over the last 3 years that we've been open, COVID being one of the main reasons for that. I believe the first year that we opened, we served upward of 100 youth within that first year. And then COVID happened. And so that decreased a little bit, but we still served, I think, 60 youth that second year. And then obviously we're within our third fiscal year now. And so I would say overall, we've served, I mean, close to 300 youth since we've been open.
I think it really depends on the milieu. It's going to depend on your staffing and what you have available for admissions. And then it's also going to depend on how many beds you have. So the Hill Country at 6 beds, there were really 7 beds. This is another thing to think about. The way that layout was, we actually put more beds than we were allowed to use so that we could make sure that girls and boys were separated, but could still maximize our bed space and have up to 6 kids, even if we had an uneven amount. So that's one thing, but looking at, sorry, forgot again. I'm getting old.
We house just a little bit differently, and we don't have enough time to go into that today, but yeah, we do house, as far as our youth, we have the ability to separate male and female, but we do house by gender identified with, not gender at birth. So that makes us just a little bit different. And I know there's gonna be tons of questions for that. So that's a different day and time. But yeah, it really depends on how many beds that you have as to what your numbers look like.
And how long those kids stay. I think we figured out an average of 4 days. Is that right, Melissa? Kids stayed on average
4.8 days. Yes, and total kiddos served for us is a little over 600 since the onset of programming. We average a little over 100 every fiscal year. And our grant prior required that we have 100 unique admissions. And so that's where we were at just prior to COVID. We've been closed since COVID.
Thank you all so very much. Before I turn it back over to Keisha to close, I wanted to put just a blatant plug in. On September 29th, next week, we're going to be having our action-informed learning series for the Action Lab. We invite everyone to join us then. Keisha has put the link in the chat. If you have not already registered, I would invite you to form a team with members of your community and sign up. This is going to be a little bit different next week. Instead of a webinar where we have people talking at you, this will be an opportunity for you to talk amongst yourselves and take the information that these subject matter experts have provided and really work with it with members of your team and your community to figure out where are the decision points for us? What are the first steps? And what are we going to do to really design a youth crisis respite center for our community? And so you can find out more information. You can click the link to register. It starts at, I think, 9 a.m. next Wednesday. It's going to be a great discussion and very structured format to really, oh, thank you, Aris, 9 to 3, to really give teams the opportunity to do some very structured planning so that you can get some traction under your feet before you go off into the wild world and you have access to some subject matter experts that can help you. So Keisha, I'll turn it back over to you.
Thank you so much, Tracy and Arnold, for helping facilitate our Q&A section. And thank you all for joining us today. And I really want to thank the panelists, Kelly, Melissa, Jessica, Teresa, Janice, and T, for sharing your insights and expertise. We know, and we've heard from you all, it can be a challenge to develop a youth crisis respite center, but it is definitely worth the effort and the collaborations within the communities. And so we just really appreciate y'all's time today and your commitment to this work. And we hope you all as participants have found the information today helpful and meaningful as you consider if youth crisis respite may be established in your communities. We will say that your feedback is very important to us. And so we have an evaluation that we are asking you all to complete. And we use this information in planning our efforts and events for Texas System of Care. So I invite you to just take just a moment or two to click on the link that I believe is in the chat. I put in the chat. So complete that. And again, we hope to see you next Wednesday, not next Tuesday, September 29th, for our action lab related to this topic.
And Keisha, I see that we've got one question. If we want to go ahead and adjourn, and if Sarah, if you want to stick around, I'll try to answer your question.
All right. Well, thank you all so much. I hope you have a great day. And again, we hope to see you next Wednesday for our action lab.
Thank you.
You.
Thanks, y'all.
Bye-bye.